And can you achieve compliance on your own without this help? And again, I will stress, for those of you who don't have an in-office regulatory compliance person, you should. That person can bring you into compliance without the help of outside people, unless you think it would be easier for you to have an outside person come in. And remember that the buck stops with you. When OSHA comes, you will not be able to say to them, I'm sorry, I'll be ready next week, but I'm not ready today. OSHA offers consultative services that are free. So let me just touch on those before I close. If you want, you can call your state labor department and ask for the consultative branch that handles OSHA inspections. Normally it's a state agency that works in consultation with OSHA. And what they will do is put you on a list, sometimes it's a waiting list, make an appointment and come to your office and conduct an inspection of your office. You will not be cited or fined if you take them up on this offer and have them come in. The only downside to having a consultative inspection is that you must agree to correct any serious violations that they identify, even if you don't agree that they're serious violations, or else they will turn you over to the real inspectors. Now, they won't turn you over at all if they find violations and you agree to correct those, and you do correct those. One advantage is if you are from a larger office and you possibly could be subject to a random target inspection. If you have a consultative inspection, you are exempt for 1 year from a random target inspection. Should you do it? I can't answer that for you. If you think you really need help, you don't think you can do it on your own, and you don't want to hire someone on the outside to come and help, I don't think you have a lot to lose. But again, you can do it on your own. And with that, I'll turn it back over to Dr. Kaufman.
Thank you, Ms. Logan, for that very easy to understand overview and exploration of dentist rights and responsibilities. And as we can see, it has triggered a number of questions. So why don't we start on my side first? Go ahead.
Hello. I have an associate in my practice. I was wondering what obligations I have to her.
If the associate is an employee, then you have the obligation as the employer for that person, just like all other employees in your office, so that you need to ensure that that associate is trained, is provided with all of the equipment and information necessary to be able to do his or her job safely in the eyes of OSHA. If the associate is an independent contractor, simply shares space with you, has his or her own patients, sets his or her own office hours, and just uses your office and equipment, then OSHA probably will respect that independent contractor status and find that you have no responsibility over that person. But if you have the right to control their work, they will overlook the legal status of independent contractor and consider that person an employee.
Thank you for the question. Gentleman on this side.
I am not incorporated. Do I need to be concerned about OSHA?
Maybe yes, maybe no. If you have any employees who work for you, OSHA could come into your office, and they couldn't cite you for any violations that you have committed yourself. For example, if you are not wearing protective eyewear, they could not cite you for your own failure to comply, but they could cite you for violations of other people in your office. And also, if you have an employee who, for example, refuses to comply or fails to comply, and you yourself have not complied, you can't say to OSHA as a defense, well, there wasn't anything I could do about it. If you are in full compliance yourself and you have an employee who's not in compliance, you can use as a defense that, well, I'm in full compliance, I've tried to make sure my employees are in compliance. So it is important for you to try to comply to the best extent possible, even if you're not incorporated. If you are a solo practitioner and you have no employees, it's just you, OSHA cannot walk into your doors if you are unincorporated. Now, if you have a spouse who comes in 1 day a week to help you out, OSHA will consider that person to be an employee. If you're by yourself, that's it.
Question from the side?
Is there any data to support OSHA's ruling that laundry cannot be removed from the office and washed at home?
No.
That is the shortest attorney answer in the history of attorney answers.
Thank you, Dr. Kaufman.
What should we do if an inspector comes into our office and wants to either observe or go into an operatory when we have a patient?
Great question. I'm glad someone asked that. I believe that a dentist employer should never allow an inspector to go into an operatory while patients are being treated. If you disagree with me and you decide that you would like to allow an inspector to go into the operatory, at the very least, you should have the patient's consent before you allow that. OSHA doesn't know what to do with this problem. It's very unique to the healthcare settings. You don't have patients in a factory or at a construction site. And I don't know how the inspectors will actually handle this if you say, stop, you can't go into this area, because they do want to observe your office at work and doing the things that you normally do. I would not allow them in that door, though, if there's a patient in the chair.
May I ask a question
Yes.
relative to that? And that is, how do you handle the potential negative connotation and impression that inspection might leave among the patients in the office, either the one in the operatory or perhaps in the waiting room, the buzz that goes through that Dr. Doe is, the inspectors here from the government?
That's a tough one. I think probably the best thing is to be prepared for that ahead of time. Just like you're prepared for questions about HIV in your office. And I would say to my patients, just very honestly, I hope there's no interruption here. I'm very sorry if there is. We have an OSHA inspector here, and we're ready for it, and we will try to cause a minimal amount of disruption to you. We're very well prepared, and our staff knows what to do.
And you emphasize that this is something that is not necessarily out of the ordinary, that this is
Sure.
complying
Absolutely.
with new federal regulations.
Absolutely.
Is it true that an inspector has the right to look at anything and everything in your office unless you demand a warrant?
Yes and no. Unless you demand a warrant, and the warrant actually limits the scope of the inspection to the items in the complaint, or unless you object during the inspection and say that you think the inspector has gone too far, the inspector will go as far as you will let him or her go. Now, when you see the mock OSHA inspection a little bit later, you will notice that the doctor says to the inspector at 2 points, "Sir, I don't understand what you're doing. You're going beyond the scope of the complaint." At that point, if that happens and the inspector goes far beyond what you think is reasonable or within the scope of the complaint, you always have the option of calling off the inspection and sending them home. We did that at the American Dental Association when the inspector came in, and that was the end of it. They did not come back and try to inspect anything else. You do want to try to maintain some level of cooperation with them, though, and if you think that it's better to allow them to go ahead and look at an area and you know you're in compliance, there isn't a problem, probably it's best to cooperate to the greatest extent that you can. But you do have the right to stop the inspection, and if you do demand a warrant, it will define for you what the inspector has a right to look at and what they don't.
Using the host prerogative to ask a question here, based upon the experience so far, is there any sense that those who either stop inspections while they're going on, or who ask to have a warrant before letting the inspector in the outcomes, are they treated any differently? In other words, I'm asking, is there a prejudice that you can see based upon whether somebody is cooperative but firm?
OSHA would tell you, if you ask them that question, that there is no difference at all in how the level of cooperation goes. We have seen one inspection of a dental office where, in my view, the fines were probably greater because the dentist asked for a warrant. Now, OSHA would deny that very, very firmly, and I would say that probably most inspectors treat an inspection as just a day-to-day part of their job. They expect the employer to be upset and concerned, and it's just something that they understand is going to happen, and they would not take it out on the employer later on with greater fines.
Thank you. Question from this side of the room.
I am an employed associate dentist. What obligations do I have to the dental assistants who work with me?
That's a tough one, too. The employed associate or the independent contractor associate probably should discuss with the owner of the practice or the owner of the premises how this should work. If, for example, OSHA comes in on a day when the owner is not there, I don't think it's advisable for the independent contractor or employed associate to conduct the walkthrough inspection, because it's possible that OSHA might consider that person to be the employer. If, for example, you have two dentists who share space and one is called an associate, but basically it's just a space sharing arrangement and they have separate patients, everything is handled separate except the record keeping, then it's possible, if they share employees, that both dentists could be cited for violations that occur. So communication between the dentists is very important to try to prevent that from happening. It really depends on the employer-employee relationship and how the office is set up. If the dentist truly is an associate employee, he or she cannot be cited for violations in that office and is not legally responsible for the actions of the assistants or hygienists or other employees in terms of OSHA.
Thank you. And we welcome your question.
May we call the ADA during an inspection if we're having difficulty?
Absolutely, yes. Please do. We encourage that.
Well, let me carry that on a little further. Inspection's going on and someone just goes to the phone, calls the ADA, and what is the most efficient way of getting to where they have to go to get an answer?
During an inspection, if the employer is concerned about something and wants to call, they should ask for the Division of Legal Affairs and ask to speak with one of the lawyers on the staff. And there are 5 lawyers on the staff who all can help and guide you through an inspection. If you have other questions that don't relate to the inspection in process, you could ask to speak with someone in the Division of Scientific Affairs at the American Dental Association, and they could be very helpful.
Thank you. A question over from that gentleman.
Kind of what you were saying, does the doctor have any rights or privileges relative to reporting a abusive inspector?
Yes, you do. If you believe that an inspector has been unfair with you or has been abusive, argumentative, or in any manner treated you in an unprofessional way, first of all, you could call the area director, or if you wanted to go higher than that, you could call the regional administrator or the top person in your state OSHA office. You could also write a letter. And if it relates to citations that are issued, the best avenue for dealing with this is in an informal conference. And you can bring up your concerns to whoever is from OSHA at that informal conference.
Relative to that informal conference, if I may, you mentioned that it's probably a good idea to have an attorney if you're going to contest. How about an attorney present at an informal conference?
If you go to the informal conference with the idea that you just want to see what this is all about and you think you're going to contest, it would be a good idea to bring your lawyer with you. If you go to the informal conference with the idea that you just want to negotiate